Exactly what causes migraines. There are certain things that can trigger them and treatment options that can really help. Now, in honor of Migraine Awareness Month, Good Housekeeping Editor Laurie Jennings is teaming up with headache specialist and neurologist Dr. Jessica Ailani to give us some education on what it is. Now, they join us now. Good morning to you both.
Good morning.
Good morning.
It's great to have you here. And doctor, I want to start with you with a very basic question. What is the big difference between a migraine and a regular headache?
So a regular headache is something that almost all of us have experienced. They are usually mild. You take something over the counter, they go away, and you forget about them the minute they're gone. A migraine is a lot more severe, and it tends to come with what we call associated symptoms. Light, sound sensitivity, stomach upset. They can get so bad and can get worse with movement that you just want to lay in bed. Chronic migraine, which is a form of migraine, is when migraines are occurring more than half the month. You're getting frequent headaches, and with those frequent headaches, you're getting symptoms of stomach upset, light, and sound sensitivity. And these are occurring at least 3 months or more in a given year, so they're very disabling.
Very good information for folks who may not have known. Now, Laurie, why is Good Housekeeping getting involved with Migraine Awareness Month?
Well, Good Housekeeping has partnered with Allergan during Migraine Awareness Month because so many people who suffer from migraines and chronic migraines are women. Women are 3 times more likely to suffer from chronic migraine than men. And of course, Good Housekeeping has a broad audience, mostly made up of women, and we want to spread the word and generate awareness that there are treatment options available. If some of these symptoms and some of these things that we've talked about today sound familiar, you don't have to suffer in silence. You can actually seek treatment, you can speak to a healthcare professional, and you can get back to living the life that you deserve to live.
Well, and there's a community out there that can sort of help support this. What kind of activities are going on for this month?
So the month of June actually starts off with our big headache meeting. The American Headache Society holds its annual scientific meeting, which actually just happened this past weekend in Boston. The very end of the meeting is a patient advocacy meeting where patients are invited to learn all the greatest research in migraine and to understand more about headache disorders and what options are available to them. So it's a great start to the month.
Mm-hmm.
Very good. Now,
and
doctor,
magazines like mine take some of the information that comes out of these meetings and puts it into the magazine, onto websites and other resources, so that people have a lot of information that they can use.
Now, doctor, why is it important for people to see a headache specialist specifically when they have these problems?
Well, I think it's important that you start with the provider that you're the most comfortable with. So opening dialogue with your primary care provider is a great place to start. But sometimes, and especially in diseases like chronic migraine, where the headaches are frequent and very difficult to treat, seeing a specialist where this is all they do all day long, who have further studied headache, have credentialing in headache, tend to go to these headache meetings, it might be a good idea, because then you can have an open dialogue about your symptoms, have a conversation about what's an acceptable treatment option to you, understand all the treatment options available to you, and that can kind of get you started on your way to a better life.
Definitely. It's always good to see somebody who knows what they're talking about, studies this all day
Exactly.
long.
Absolutely.
Can help you really feel a lot better. So ladies, if we want to learn a little bit more about this, all the activities that are going on, where can people go for resources?
A great website to check out is BotoxChronicMigraine.com. That's a great place where people can go to learn more about treatment options. They can go to find a healthcare specialist in their area by typing in their zip code. And then they can also just see what else is going on in terms of signs and symptoms and answer some questions, look at frequently answered questions so that they can really inform themselves. So once again, that website, BotoxChronicMigraine.com.
Excellent. Very important to highlight this for people, and I want to thank you both so much for joining us today.
Thank you.
Thank you.
All right. Stay right where you are. The Morning Blend will be right back.